So when you go on the internet and you look at facelift, as a potential customer, it can be very confusing. There are hundreds of doctors and surgeons offering facelift. You will come through various options such as a thread lift or a weekend lift or a smash lift or a deep plane lift, and they all are called facelift. The issue is that they all are extremely different. It's like comparing apples to peaches. When you talk about facelift in terms of surgical facelift, the key difference is whether the surgery is limited to skin and smash layer, which is a fascia layer under the skin, or you go deep to the fascia or smash layer extensively to reposition the entire smash and the platysma muscle in the neck. That is the key distinction. What happens in UK at least is most surgeons, when they say I'm going to do a facelift for you, will limit their surgery just to the skin, or at the most do a little bit of surgery on this smash where they will either put suture or they take a strip out rather than going deep to the smash layer. A true deep plane facelift, on the other hand, means going extensively deep to the smash and specifically removing some of the anchor points which bind the smash layer down. Why is it important? It is important because that's the only way you can mobilize the smash layer, and that's the only way you can address the specific problem of aging. See, the aging problem is not because the skin only has gone down. It is because the deeper smash layer and the fat layer, they have gone down because of gravity and because of laxity of tissue with aging. So what the deep plane facelift does is free up and mobilize the smash layer so that it can be repositioned in a higher plane and give you a much more natural result. So what do you ask for a surgeon, or when you go to see a surgeon? The key question you need to ask is the surgeon going deep to the smash layer? Secondly, is the surgeon dividing the anchor points or the ligaments which hold the smash layer down? And is the surgeon doing a composite flap, which means that they are not separating the skin and the smash layer? Because when you do a composite extensive deep plane facelift, you get the best result, the most natural result, and the longest lasting result, in my opinion. The aging changes are because the deeper tissue, that are the muscles, the fat, they have gone down with and they have sagged because of aging and laxity. So the benefit of deep plane facelift is that you're mobilizing the actual tissue that has sagged. The second benefit is that you are not putting so much stretch on the skin. All the repositioning is primarily of the smash and the fat tissue. So because of that, there is a natural elevation of the skin rather than artificial yanked up, stretched out, operated looking appearance of the skin. And because you are addressing the underlying problem, you get the longest lasting result. See, any surgery does not stop you from aging, but the deep plane facelift, because it gives you a longer lasting result, a more natural result with very little stress or tension on the skin, you end up getting a very normal looking face. It is still your face. It is not your operated face, but your face looks like the way it used to look when you were younger, rather than an operated upon artificial appearance. So in my practice, I almost exclusively do deep plane facelift for all my patients, purely because it gives them a much more harmonized natural result, and they get the most long-lasting result. It also means that their recovery is better. So in my practice, in my experience, most patients who come to me get a facelift which includes neck lift. They do get a deep plane facelift, but they also get an eyebrow repositioning. So I tend to address all these parts of your face and neck in the same setting. Some of them might also get a lip lift or an eyelid rejuvenation at the same time. So what I do is I would go deep to the platysma muscle in the neck and free it up. I would go deep to the smash muscle in the face and free it up, and then I would also reposition the brow. So in effect, when the patient recovers from the surgery, they have got a full rejuvenation from their forehead to the face to the neck. An ideal candidate is someone who has got a physical changes associated with aging, someone who is in reasonable good health, and someone who is psychologically healthy to have a major procedure done. Traditionally, we have always thought about a certain age group, but nowadays, more and more, people up to mid-30s and over are suitable for deep plane facelift. Clearly, patients who are not doing too well because of their general health or other illness, there might be some modification required. But generally speaking, those are the criteria I would use. So this is a very important thing to understand. You will need to invest 2 to 3 weeks to recover from the surgery. And the recovery phase is not much different from a superficial skin or a SMAS facelift. In fact, most people will have less bruising and less swelling after a deep plane facelift simply because the plane of surgery is deeper rather than superficial limited to skin. Most patients don't have significant pain. Most patients are able to stand up, walk around, and get on with their regular activity from the evening of surgery once they have recovered from the impact of the anesthesia. So in the first week, what I recommend my patient is to gradually build up their physical normal activity. I do request them to sleep, when they are sleeping, to sleep with their head propped up slightly to help with the swelling. We see them 2 weeks usually after surgery to remove sutures or to check up on the wound. But many patients do come back after 4 to 5 days to just for a routine check and for taking care of any superficial stitches. Most patients at the end of 2 weeks will be able to resume almost all of their activity. They can go out for a walk, they can resume light exercises. In terms of heavy exercise and swimming, I do advise that you should give yourself 3 weeks at least to recover from the surgery. So deep plane facelift, or any facelift for that matter, is a major surgery. So first thing to recognize is that you should not go in thinking this is a quick in and out. If you want good results, long-lasting results, you will have to invest your time. It is a major surgery. And it can take up to 3 to 4 hours to do it properly. In terms of risk, any surgery has risk of bleeding, infection, poor wound healing, or excessive scarring. Those are extremely rare, but they can happen after a deep plane facelift. The specific risk associated with the deep plane facelift is temporary or permanent damage to the nerve that supplies your face, called the facial nerve. It is again very rare, and because of that fear, most surgeons do not do a deep plane facelift. My training as a head and neck surgeon means that even outside doing facelift, I'm always operating on the complex, deeper part of the head and neck area. I take care in my NHS practice large tumors affecting the parotid or the facial nerve. So I'm very comfortable and conversant operating in and around the facial nerve, which gives me the confidence to do a deep plane facelift appropriately. However, there is no surgeon in the world who can say there is zero risk of damage to the facial nerve. But statistically, the risk of having a permanent damage to the nerve is less than 1%. The chances of having some temporary weakness is in around 5% of patients, which means that 95% of patients who have this surgery will have no problem with their facial nerve whatsoever. The other important thing to keep in mind is that by nature, the halves of our face are not symmetrical. So even without a surgery or before surgery, the right half of your face is never the same as the left half. So there will be some asymmetry, and after surgery, some of that asymmetry may become more noticeable. That usually happens because after surgery, you are seeing your face too much and you are paying attention to every small detail. But that's the other thing to keep in mind. So after having a good quality composite deep plane face and neck lift, in theory, the result will last forever because your face and neck is never going to be the same as it would have been without the surgery. However, the aging changes will continue to happen even after a deep plane facelift. And the aging changes are not just limited to your skin. The jawbone, and the bone becomes thinner with time. The muscles start losing their volume. So all of those will continue to progress whether you have a surgery or you don't have surgery. But typically, after a good quality deep plane facelift, you can still see the changes and the impact, the positive impact of surgery for up to 10 to 15 years. So one of the key reasons I changed over my surgical practice to deep plane facelift is to get a natural, long-lasting result. The result of a surgery are dependent on a number of factors. The first thing is the patient factor, which is what is your expectation as a patient? Do you understand the surgery that you are getting done, and do you have a good idea about the results that you can expect? And the second factor is the surgeon, whether the surgeon understands what you want and whether the surgeon has the expertise to deliver, which are your end goals. So for me, the natural result is achievable by looking at the patient expectation and seeing that my expertise and the technique I'm going to use are going to deliver that. At times, I will ask you to bring your pictures when you were 30, 20-year-old or 40-year-old to see how your facial structure was. And I'll try to deliver that to you with my deep plane facelift. I will make sure that the incisions or the cut on your skin are hidden. I use the elevation in the natural plane so that they are elevated and they are in keeping with your natural appearance when you were younger. So many patients do ask about the anesthesia. I typically work with the same anesthetist, and we work as a team to ensure that your anesthesia is safe and your recovery is as smooth as possible. When we talk about deep plane facelift, depending upon your fitness and your choices, we offer either a general anesthesia or a twilight or a sedation anesthesia. General anesthesia is when you are completely asleep and your breathing is being supported through an anesthesia machine, and typically you will have some tube to help you breathe. The twilight anesthesia is a lay term used for sedation. In sedation, you are still breathing on your own. You normally don't have any tube down your throat. You are like in a very deep sleep, but you are arousable. So that is preferred by a huge proportion of patients because the recovery is better. Typically, they will not have a sore throat. However, there are limitations. So you need to have certain fitness. You need to meet certain conditions before you are safe to have a twilight anesthesia. When it comes to British Face Clinic, before your surgery, you will have a conversation with our anesthetist who will look at your medical history, who will look at your preferences, and he will be able to take a decision if twilight anesthesia is safe for you. So when you look at deep plane or any kind of facelift, there are three structures that you will come across on the net, and there are three kinds of facelift that you should know about. The three structures are your skin, SMAS, and ligament that you will come across when you search facelift on the internet. The skin is pretty obvious what it is. The SMAS is a layer on your face which is partly fascia, which means it's made of connective tissue with some muscles in it. This mass continues into your neck as something we call as a platysma muscle. The third thing to be aware is ligament. Ligament are fibrous bands which hold different parts of your body in place. So in your face, you have three main ligaments which are relevant to this surgery, and they hold this mass layer in place. So with the understanding of these three anatomical structures, we can move on to the different kind of facelift. The first is a skin-only facelift, and many surgeons sell it as a weekend or a keyhole facelift. Essentially what happens in this surgery is that the skin is elevated over your SMAS, and then the skin is pulled tight, and when you pull the skin tight, you end up with some extra skin that is removed. So it seems like a very quick surgery. The downside of this is because all this stress is on your skin, it gives you the typical operated look. You look like someone who has had something done unnatural to your face. The second big problem is skin is elastic. So after some time, the skin will loosen up again and you're back to where you were. The second kind of surgery is called a SMAS lift. And what happens in a SMAS lift is that typically the surgeon will, after lifting this skin, go to your SMAS layer, and some surgeons will use a suture or a stitch to tighten the SMAS, or some surgeons will take a strip out of a SMAS to put sutures and tighten it up again.
Okay, just move your tie over slightly. There we go.
So this is a little bit better than the skin lift only. The problem is, again, because you have not mobilized the SMAS tissue completely, the improvement is very limited, and you are again mostly relying on the skin stretch to give you some benefit. That brings us to the third surgery, which is a deep plane facelift. This is typically combined with a neck lift because, as I said, the SMAS and the platysma are a continuous anatomical structure. So what happens in a deep plane facelift is that the surgeon will make a cut on the SMAS and then go quite far in the front, almost to your lips and to your nose. And in doing so, the surgeon will have to divide some ligament which anchor the SMAS. Once those ligaments are divided, then the SMAS can be mobilized very properly and the platysma muscle can be mobilized in the correct manner. That mobilization allows the surgeon to elevate the SMAS layer. The skin is typically not separated from the platysma or the SMAS layer, so that there is less bruising and the health and the blood perfusion of your skin is maintained. This is the gold standard in my opinion, because this really addresses the problem that is leading to your sagging appearance, and this, by avoiding any stress or tension on your skin, gives you the most natural result. Deep plane facelift is a technically demanding, complicated major surgery. And the reason most surgeons do not do a true deep plane composite flap is because of the risk associated and the technical demands of the surgery. I have been trained for more than a decade, and besides doing major head and neck surgery, I have made sure that I get skilled in a proper deep plane facelift. To do so, I have had a fellowship in United States of America, where I picked up the nuances associated with deep plane facelift. In addition, I have spent time with world-renowned surgeons like Dr. Giocano in New York or Dr. Piscali in Italy to further refine my technique. And it's my journey and my experience that has made me give up on the skin only or the SMAS facelift and move on almost exclusively to the deep plane facelift. The other thing to keep in mind is that my cosmetic practice is just limited to face. I do not do any other surgery. All of my cosmetic practice consists of some form of facelift, rhinoplasty, or eyelid surgery or ear repinning. That has allowed me to focus all my skill and experience onto the facial area. And that over more than a decade has helped me build my confidence that I can offer you the best possible surgery anywhere in the world.